Anthelmintic drugs. Drugs that act against the nematodes are called anthelmintic drugs. Medically important intestinal nematodes responsive to the drug therapy includes Enterobius, Trichurus, Ascaris, and Cyclostoma strongyloides, which is pinworm, biworm, roundworm, hookworm, and threadworm. Anthelmintic drugs, which are the drugs that can act against the nematode I said before. The first main anthelmintic drug is the albendazole. Mechanism of action is it blocks the glucose uptake in both larval and the adult parasite, leading to decrease the formation of ATP and the subsequent parasite immobilization. It also inhibits the microtubule assembly. The clinical use is they have the wide anthelmintic spectrum. The alternative drug for larva migrants, ascariasis, and the infections that are caused by roundworm, sweetworm, hookworm, pinworm, and threadworm. It is also active against the poke tapeworm in the larval stage. While speaking about the toxicity, they has few toxic effects during the short courses of therapy. During the prolonged use, reversible leukopenia, alopecia, and the changes in the enzymes may occur. Long-term animal toxicity studies report the bone marrow suppression and the fetal toxicity. Triethyl carbamazine, the mechanism of action is it immobilizes the microflora by an unknown mechanism, increasing the susceptibility to the host defense mechanism. Clinical use, it is a drug of choice for the filariasis and the alternative drug. When it is used in the combination with the suramine for the onchoriasis, it is rapidly absorbed from the gut and excreted in the urine. While speaking about the toxicity, the adverse effects include the headache, malaise, weakness, and anorexia. Reactions to proteins released by the dyeing rashes, ocular damage, joint and the muscle pain, and the lymphangitis. On onchoriasis, the majority reaction include most of these symptoms, as well as the hypotension, pyrexia, respiratory distress, and the postration. Ivermectin, the mechanism of action is it infects a GABA-mediated neurotransmission in the nematodes and causes the immobilization of the parasite, facilitating their removal by the RES. The selective toxicity results because in humans the GABA is a neurotransmitter only in the CNS. It does not cross the blood-brain barrier. Now speaking about the clinical use, it is a drug of choice for the onchoriasis and acts more slowly than the diethyl carbamazine. It causes a fever, fewer systemic and the ocular reactions. It is also the drug of choice for the strongyloides and the alternative agent in the filariasis. Their toxicity is nearly the single dose oral treatment in the onchoriasis results in the majority reaction that includes the fever, headache, dizziness, rashes, pruritus, tachycardia, hypotension, and the pain in joints, muscles, and the lymph glands. These symptoms are usually of the short duration and most can be controlled with the antihistamine and NSAID. Mebendazole. The mechanism of action is they are selectively inhibits the microtubule synthesis and glucose uptake in the nematodes. Clinical use, the drug of choice for the pinworm and the whipworm infection. It is one of the two drugs of choice with the parental pamot for the roundworms and for the combined infections with the ascariasis and the hookworm. The backup drug in the certain cystodes and the traumatous infection. They are less than 10% of the drug which is absorbed systematically after the oral use. And this portion is metabolized rapidly. The toxicity is mebendazole toxicity is limited to the gastrointestinal irritation, contradictive in the pregnancy because of the possible embryotoxicity. Piperazine. The mechanism of action is paralysis the ascariasis by acting as an agonist at the GABA receptor. The paralyzed roundworms are expelled alive by the normal peristalsis. Their clinical use, it is the alternative drug for the ascariasis, and the toxicity is mild GIT irritation is the most common side effect. It should not be used in the patient with the seizure disorder. Parental pamota. The parental pamota and its congener, the occidental pamota, stimulate the nicotine receptor present at the neuromuscular junction of the nematodes. The contraction of the muscles occur followed by the depolarization induced paralysis. Their clinical use is one of the two drugs of choice with the mebendazole for the infection due to the hookworm, pinworm, and the roundworm. They are poorly absorbed when given orally. Their toxicity is the adverse effects are minor, but they include GID distress, headache, and the weakness. Mebendazole. The mechanism of action is the structure congener of the mependazole and has a similar action of the microtubules. The drug of choice for the visceral forms of lava migrans, and it is an effective drug for the treatment of the strongly disease, cutaneous lava migrans and the threadworm infection. They are rapidly absorbed from the gut and it is metabolized in the liver by the enzyme. It has the anti-inflammatory and the immunoreceptive actions in the host. Toxicity: the GI irritation, headache, dizziness, drowsiness, leukopenia, hematuria, and the allergic reaction, which is including intrahepatic cholestasis. The reactions is caused by dying parasites, including the fever, chills, acne, retinopathy, and skin rashes. Drugs that act against the nematodes are medically important nematodes, which are used in the blood fluke, liver fluke, and the lung fluke. Praziquantel. The mechanism of action is they increases the membrane permeability to the calcium, causing the marked initially and a paralysis of the trematode muscle. This is followed by the vacuolization and the parasitic death. The wide anti-helmintic spectra for the trematodes and the cystoid infection, the drug of choice in the cystiomyces, chlorentiasis, and the paragonemiasis. They are against the immature and the adult isotomer forms. Praziquantel is one of the two drugs of choice with the neclomide for the infection due to the cystodes. All common tampons are used in the treatment of the cystiocases. The pharmacokinetics: absorption from the gut is rapid. They are metabolized by the liver to the inactive products. Anti-helmintic drugs. Their toxicity is nearly the common adverse effect like headache, dizziness, malaise, and less frequently the gastrointestinal irritation, skin rashes, fever. They are contraindicated in the ocular cystiorrhosis. Butanol. Their drug of choice for the treatment of the sheep liver fluke and the alternative agent in the paragonemiasis. Their toxicity is common adverse effect include the nausea and vomiting, diarrhea, abdominal cramps, dizziness, headache, and they have the toxicity with the infections. Metformin, organophosphate product that is converted in the body to the cholinesterase inhibitor. Active metabolite act solely against the system hematobium, the cause of the bilharziasis. The toxic effect occur from the excess cholinergic stimulation. Oxamnitin. The effect is solely in the Cystoma manzoni infection acting on the male immature forms. The dizziness is the common adverse effect. Headache, gastrointestinal irritation, and the pruritus may occur. Reactions to the dying parasite include the eosinophila, urticaria, and the pulmonary infiltrates. It is not advisable to use the drug in the pregnancy or in the patient with a past history of the seizure disorders. While speaking about the drug that act against the cystodes like tapeworms, which is a beef tapeworm, pork tapeworm, fish tapeworm, and the dog tapeworm, Tania saginata, niclosamide, they act by uncoupling the oxidative phosphorylation or by the activating ATPases. One of the two drug of choice with the praziquantel for the infection caused by the beef, pork, and the fish tapeworm infection. It is not effective in the cystiorrhosis or the hydatid disease caused by the Echinococcus granulosus. Scoliosis and the cystode segments are killed by the ova or not. Effective in the treatment of infection due to the small and the large intestinal fluids. Toxic effects are usually mild, but they include the gastrointestinal distress, headache, rashes, and fever. Thank you.